51. What is the primary pathophysiological process in a hemorrhagic stroke? A. Plaque buildup in arteries. B. Rupture of a cerebral blood vessel. C. Loss of myelin in neurons. D. Dopamine depletion. Answer: rupture of a cerebral blood vessel. Rationale: hemorrhagic stroke occurs when a vessel bursts, causing brain bleeding. Option B is correct. Option A fits ischemic stroke. Option C relates to MS. Option D is Parkinson's. 52. Which symptom is most indicative of a tension headache? A. Pulsating pain on one side. B. Band-like pressure around the head. C. Visual aura before onset. D. Severe nausea and vomiting. Answer: band-like pressure around the head. Rationale: tension headaches cause a tight, band-like pain, unlike migraines. Option B is correct. Options A, C, and D describe migraines, not tension headaches. 53. What is a significant risk factor for traumatic brain injury, TBI? A. High-fiber diet. B. Motor vehicle accidents. C. Low sodium intake. D. Regular yoga practice. Answer: motor vehicle accidents. Rationale: MVAs are a leading cause of TBI due to head trauma. Option B is correct. Options A, C, and D are unrelated or protective factors. 54. Which diagnostic test is used to assess spinal cord injury extent? A. EEG. B. MRI of the spine. C. Blood culture. D. Chest X-ray. Answer: MRI of the spine. Rationale: MRI visualizes spinal cord damage, assessing injury extent. Option B is correct. Option A tests brain activity. Options C and D assess infection or lungs, not spine. 55. What is the primary treatment for acute ischemic stroke within 4.5 hours? A. Anticonvulsants. B. Thrombolytic therapy, TPA. C. Antibiotics. D. Muscle relaxants. Answer: thrombolytic therapy, TPA. Rationale: TPA dissolves clots in ischemic stroke if given within 4.5 hours, restoring blood flow. Option B is correct. Options A, C, and D treat seizures, infections, or spasticity, not stroke. 56. Which complication is most likely in a patient with meningitis? A. Improved hearing. B. Hydrocephalus. C. Enhanced reflexes. D. Clearer vision. Answer: hydrocephalus. Rationale: meningitis can block CSF flow, causing hydrocephalus. Option B is correct. Options A, C, and D are improvements, not complications. 57. What should a nurse teach a patient with MS to manage heat sensitivity? A. Take hot showers daily. B. Use cooling vests and avoid heat. C. Exercise in direct sunlight. D. Drink hot beverages often. Answer: use cooling vests and avoid heat. Rationale: heat worsens MS symptoms. Cooling and heat avoidance help. Option B is correct. Options A, C, and D exacerbate symptoms. 58. Which cranial nerve is tested by asking a patient to shrug their shoulders? A. Facial, 7. B. Accessory, 11. C. Vagus, X. D. Trigeminal, V. Answer: accessory, 11. Rationale: the accessory nerve 11 controls trapezius muscles for shrugging. Option B is correct. Options A, C, and D affect face, viscera, and sensation, not shoulders. 59. What is a common early sign of a brain tumor? A. Improved memory. B. Morning headache with vomiting. C. Enhanced coordination. D. Steady gait. Answer: morning headache with vomiting. Rationale: brain tumors raise ICP, causing morning headaches and vomiting. Option B is correct. Options A, C, and D suggest normal function, not tumor signs. 60. Which imaging modality is best for detecting acute brain hemorrhage? A. Ultrasound of the head. B. Non-contrast CT scan. C. PET scan. D. Spinal MRI. Answer: non-contrast CT scan. Rationale: non-contrast CT quickly identifies acute bleeding in the brain. Option B is correct. Options A, C, and D are less effective or target other areas. 61. What should a nurse monitor in a patient with a recent spinal cord injury? A. Bowel and bladder function. B. Hair growth rate. C. Skin color only. D. Room temperature. Answer: bowel and bladder function. Rationale: spinal cord injury disrupts autonomic control, affecting bowel/bladder. Option A is correct. Options B, C, and D are unrelated or less critical. 62. Which medication helps manage tremor in Parkinson's disease? A. Carbidopa-levodopa. B. Insulin. C. Prednisone. D. Penicillin. Answer: carbidopa-levodopa. Rationale: carbidopa-levodopa boosts dopamine, reducing Parkinson's tremors. Option A is correct. Options B, C, and D treat diabetes, inflammation, and infection, not tremors. 63. What is a key environmental risk factor for stroke? A. Secondhand smoke exposure. B. High vitamin intake. C. Regular stretching. D. Low noise levels. Answer: secondhand smoke exposure. Rationale: smoke damages vessels, raising stroke risk. Option A is correct. Options B, C, and D are protective or unrelated. 64. Which finding indicates a patient may be experiencing a migraine aura? A. Steady hand movements. B. Flashing lights in vision. C. Normal speech pattern. D. Improved balance. Answer: flashing lights in vision. Rationale: migraine auras often involve visual disturbances like flashing lights. Option B is correct. Options A, C, and D indicate normal function, not aura. 65. What should a nurse do first when a patient with a head injury becomes unresponsive? A. Administer pain medication. B. Assess airway and breathing. C. Apply a cold pack to the head. D. Call the family immediately. Answer: assess airway and breathing. Rationale: unresponsiveness requires ABC priority. Airway and breathing ensure survival. Option B is correct. Options A, C, and D delay critical assessment. 66. Which complication is linked to untreated epilepsy? A. Improved cognition. B. Sudden unexpected death in epilepsy, SUDEP. C. Enhanced muscle strength. D. Better sleep quality. Answer: sudden unexpected death in epilepsy, SUDEP. Rationale: SUDEP is a rare but serious epilepsy risk from uncontrolled seizures. Option B is correct. Options A, C, and D are not complications. 67. What should a nurse teach to reduce seizure risk in epilepsy? A. Skip medications occasionally. B. Take anticonvulsants as prescribed. C. Increase caffeine intake. D. Avoid regular sleep. Answer: take anticonvulsants as prescribed. Rationale: consistent anticonvulsant use prevents seizures. Option B is correct. Options A, C, and D increase seizure risk via noncompliance or triggers. 68. Which disorder is associated with demyelination of the spinal cord? A. Parkinson's disease. B. Multiple sclerosis. C. ALS. D. Bell's palsy. Answer: multiple sclerosis. Rationale: MS involves demyelination of CNS, including spinal cord. Option B is correct. Options A, C, and D affect dopamine, motor neurons, or facial nerves, not myelin. 69. What lab test monitors for toxicity in carbamazepine therapy? A. Serum carbamazepine level. B. Blood glucose. C. Thyroid panel. D. Lipid profile. Answer: serum carbamazepine level. Rationale: monitoring carbamazepine levels prevents toxicity, e.g., ataxia. Option A is correct. Options B, C, and D assess unrelated systems. 70. Which strategy aids communication in a patient with post-stroke aphasia? A. Speak loudly and quickly. B. Use simple phrases and gestures. C. Avoid talking to them. D. Use complex medical terms. Answer. Use simple phrases and gestures. Rationale. Simple language and gestures aid understanding in aphasia. Option B is correct. Options A, C, and D hinder communication or exclude the patient. 71. What is the primary transmission mode for viral encephalitis? A. Mosquito bites. B. Direct skin contact. C. Contaminated water. D. Airborne droplets. Answer. Mosquito bites. Rationale. Viral encephalitis, e.g., West Nile, often spreads via mosquito vectors. Option A is correct. Options B, C, and D fit other diseases, not encephalitis. 72. Which symptom suggests worsening ALS? A. Improved swallowing. B. Increased muscle weakness and atrophy. C. Enhanced reflexes. D. Better coordination. Answer. Increased muscle weakness and atrophy. Rationale. ALS progresses with motor neuron loss, worsening weakness and atrophy. Option B is correct. Options A, C, and D indicate improvement, not ALS progression. 73. What is a lifestyle risk factor for developing migraines? A. Consistent sleep schedule. B. Chronic stress. C. Regular exercise. D. High water intake. Answer. Chronic stress. Rationale. Stress triggers migraines by altering brain chemistry. Option B is correct. Options A, C, and D reduce migraine risk. 74. Which test confirms Guillain-Barré syndrome diagnosis? A. Nerve conduction study. B. Blood pressure check. C. Urine culture. D. Echocardiogram. Answer. Nerve conduction study. Rationale. Nerve conduction studies show slowed signals in GBS due to nerve damage. Option A is correct. Options B, C, and D assess unrelated systems. 75. What is the goal of levodopa therapy in Parkinson's disease? A. Cure the disease. B. Relieve motor symptoms. C. Prevent memory loss. D. Reduce blood sugar. Answer. Relieve motor symptoms. Rationale. Levodopa eases tremors and rigidity by increasing dopamine. Option B is correct. Options A, C, and D misalign with its purpose. 76. Which complication arises from untreated hydrocephalus? A. Improved vision. B. Brain herniation. C. Enhanced memory. D. Steady gait. Answer. Brain herniation. Rationale. Untreated hydrocephalus raises ICP, risking herniation. Option B is correct. Options A, C, and D are not complications. 77. What should a nurse teach a patient with TBI to prevent re-injury? A. Avoid helmets in sports. B. Wear protective gear during activities. C. Skip rest after activity. D. Increase alcohol use. Answer. Wear protective gear during activities. Rationale. Protective gear reduces re-injury risk in TBI patients. Option B is correct. Options A, C, and D increase vulnerability. 78. Which condition causes sudden, brief muscle jerks during sleep? A. Myoclonus. B. Stroke. C. Parkinson's disease. D. Multiple sclerosis. Answer. Myoclonus. Rationale. Myoclonus involves sudden, involuntary jerks, often during sleep. Option A is correct. Options B, C, and D cause weakness, tremors, or spasticity, not myoclonic jerks. 79. What test assesses brain function after a suspected stroke? A. Neurological exam. B. Blood lipid levels. C. Kidney function test. D. Liver enzyme panel. Answer. Neurological exam. Rationale. A neuro exam, e.g. NIHSS, evaluates stroke deficits like speech or motor skills. Option A is correct. Options B, C, and D assess unrelated systems. 80. Which non-pharmacological intervention helps Parkinson's balance issues? A. Prolonged bed rest. B. Balance training with physical therapy. C. High-fat diet only. D. Avoiding all movement. Answer: balance training with physical therapy. Rationale: PT improves balance and reduces fall risk in Parkinson's. Option B is correct. Options A, C, and D worsen mobility or are unrelated. 81. What is the primary pathophysiological cause of epilepsy? A. Excessive dopamine production. B. Abnormal electrical activity in the brain. C. Myelin overgrowth. D. Cerebral vessel rupture. Answer: abnormal electrical activity in the brain. Rationale: epilepsy results from uncontrolled neuronal firing causing seizures. Option B is correct. Option A fits Parkinson's treatment. Option C is unrelated. Option D is hemorrhagic stroke. 82. Which symptom is most specific to trigeminal neuralgia? A. Constant dull headache. B. Sharp, electric shock facial pain. C. Gradual vision loss. D. Muscle weakness in legs. Answer: sharp, electric shock facial pain. Rationale: trigeminal neuralgia causes sudden, severe facial pain from nerve irritation. Option B is correct. Options A, C, and D suggest other conditions like tension headache or MS. 83. What is a major risk factor for developing cerebral palsy? A. Premature birth. B. High calcium intake. C. Regular stretching. D. Excessive sunlight exposure. Answer: premature birth. Rationale: prematurity increases cerebral palsy risk due to brain vulnerability. Option A is correct. Options B, C, and D are unrelated or protective. 84. Which diagnostic test is most useful for confirming Alzheimer's disease? A. EEG. B. Brain MRI with atrophy patterns. C. Blood pressure monitoring. D. Spinal tap for infection. Answer: brain MRI with atrophy patterns. Rationale: MRI shows hippocampal atrophy typical in Alzheimer's, aiding diagnosis. Option B is correct. Option A fits seizures. Option C and D assess unrelated issues. 85. What is the primary treatment for managing spasticity in cerebral palsy? A. Antibiotics. B. Muscle relaxants like baclofen. C. Antihistamines. D. Blood thinners. Answer: muscle relaxants like baclofen. Rationale: baclofen reduces spasticity by relaxing muscles in cerebral palsy. Option B is correct. Options A, C, and D treat infections, allergies, or clots, not spasticity. 86. Which complication is most associated with chronic stroke survivors? A. Enhanced memory. B. Depression. C. Improved reflexes. D. Better coordination. Answer: depression. Rationale: stroke survivors often face depression due to disability and brain changes. Option B is correct. Options A, C, and D are not typical post-stroke outcomes. 87. What should a nurse teach a patient with myasthenia gravis to manage symptoms? A. Exercise vigorously daily. B. Rest during periods of fatigue. C. Skip medications for rest. D. Increase heat exposure. Answer: rest during periods of fatigue. Rationale: rest conserves energy, reducing NG muscle weakness. Option B is correct. Options A and D worsen fatigue. Option C risks crisis from noncompliance. 88. Which cranial nerve deficit causes double vision in a stroke patient? A. Optic, 2. B. Oculomotor, 3. C. Vagus, X. D. Facial, 7. Answer: oculomotor, 3. Rationale: oculomotor nerve 3 controls eye movement. Its damage causes diplopia. Option B is correct. Options A, C, and D affect vision, viscera, or face, not eye alignment. 89. What is a hallmark symptom of a cerebellar stroke? A. Memory loss. B. Ataxia and coordination loss. C. Facial drooping only. D. Chest pain. Answer: ataxia and coordination loss. Rationale: cerebellar stroke disrupts balance and coordination, causing ataxia. Option B is correct. Options A, C, and D fit other stroke types or conditions. 90. Which imaging is critical for diagnosing hydrocephalus? A. Chest X-ray. B. CT, scan showing ventricle size. C. Abdominal ultrasound. D. Knee MRI. Answer: CT scan showing ventricle size. Rationale: CT scans reveal enlarged ventricles in hydrocephalus. Option B is correct. Options A, C, and D assess unrelated areas. 91. What should a nurse monitor in a patient post-seizure for complications? A. Hair condition. B. Postictal confusion and injury. C. Skin hydration only. D. Room lighting. Answer: postictal confusion and injury. Rationale: post-seizure, confusion and injuries, e.g., falls, are key risks to monitor. Option B is correct. Options A, C, and D are unrelated to immediate complications. 92. Which medication is used to prevent migraines? A. Propranolol. B. Levodopa. C. Insulin. D. Amoxicillin. Answer: propranolol. Rationale: propranolol, a beta blocker, prevents migraines by reducing vascular triggers. Option A is correct. Options B, C, and D treat Parkinson's, diabetes, or infection. 93. What is a genetic risk factor for Huntington's disease? A. High cholesterol. B. CAG repeat mutation on chromosome 4. C. Low vitamin B12 levels. D. Regular exercise. Answer: CAG repeat mutation on chromosome 4. Rationale: Huntington's is caused by a CAG repeat expansion, a genetic defect. Option B is correct. Options A, C, and D are unrelated. 94. Which finding indicates a patient is having an absent seizure? A. Violent jerking movements. B. Brief staring with unresponsiveness. C. Steady gait. D. Clear verbal response. Answer: brief staring with unresponsiveness. Rationale: absent seizures cause brief lapses in awareness with staring. Option B is correct. Options A, C, and D fit tonic-clonic seizures or normal behavior. 95. What should a nurse do first when a patient with Parkinson's falls? A. Lift them back to bed quickly. B. Assess for injuries and vital signs. C. Administer extra levodopa. D. Call the family first. Answer: assess for injuries and vital signs. Rationale: assessing ensures safety and identifies harm post-fall. Option B is priority. Options A, C, and D act without data or delay care. 96. Which complication is linked to untreated multiple sclerosis? A. Enhanced vision. B. Paralysis from muscle weakness. C. Improved balance. D. Better memory. Answer: paralysis from muscle weakness. Rationale: MS progression can lead to paralysis from demyelination and weakness. Option B is correct. Options A, C, and D are not MS outcomes. 97. What should a nurse teach to prevent worsening of Bell's palsy symptoms? A. Chew on the affected side. B. Protect the eye with drops or patch. C. Avoid facial exercises. D. Increase cold exposure. Answer: protect the eye with drops or patch. Rationale: Bell's palsy impairs eye closure. Protection prevents drying or injury. Option B is correct. Options A, C, and D worsen symptoms or delay recovery. 98. Which condition causes progressive cognitive decline and chorea? A. Stroke. B. Huntington's disease. C. Myasthenia gravis. D. Epilepsy. Answer: Huntington's disease. Rationale: Huntington's features chorea and cognitive decline from basal ganglia damage. Option B is correct. Options A, C, and D cause weakness, fatigue, or seizures, not chorea. 99. What lab test is critical before starting thrombolytics for stroke? A. INR, coagulation status. B. Blood glucose only. C. Cholesterol level. D. Thyroid function test. Answer: INR, coagulation status. Rationale: INR assesses bleeding risk before thrombolytics like TPA. Option A is correct. Options B, C, and D monitor other conditions, not clotting. 100. Which non-pharmacological strategy helps manage epilepsy seizures? A. Avoid sleep entirely. B. Maintain a seizure diary for triggers. C. Increase loud noise exposure. D. Skip regular meals. Answer. Maintain a seizure diary for triggers. Rationale. A diary identifies and helps avoid seizure triggers. Option B is correct. Options A, C, and D increase seizure risk.